that I wanted to do today is ask a special guest to be with me here today because of the current situation. And my part is going to be very brief and very quick. Quite simply, we are in a crisis. This is something we've talked about for a long time. It's something we planned for going back to last year if we ever got to this point. And we are there, folks. I want you to know we are in a healthcare crisis. The state of Oregon has seen we are now the eighth highest in the country increase in hospitalizations across the state. Southern Oregon is in a very difficult place right now. There are 150 COVID hospitalized patients in Southern Oregon. 43 of those are at Three Rivers. And we have created additional spaces to put people because we have so many patients that we are completely overwhelmed. We have set up a tent in front of the hospital, in front of the emergency department. The emergency department is completely overrun with patients that are coming in with COVID symptoms or needing a COVID test that we simply can't handle the volume. It's overwhelming. We've called in the National Guard to help, folks. That's where we're at right now. And so I'm going to ask Dr. Nelson to kind of talk a little bit more about this, because I want you to know this is very serious and I'm deeply concerned for our community.
Thank you. Thanks for letting me come and speak. And I appreciate Wynn and the work that he's doing. And I know many of you, and I'm grateful for all of your service to our community. I want to take everybody back to a year and a half ago on March 11th, when our country started shutting down in 2020. And I remember thinking at that time, this cannot be that big of a deal. And then watching over the subsequent months what was happening in Italy and New York City and thinking, well, those are long, far away places, and it's never going to come to Grants Pass. And honestly, for 6 months, we didn't really even have much in the way of COVID here. And personally, I had feelings like, well, we're being kind of silly, but okay, this is what we need to do to protect one another. In October of 2020, we began to see some increases in our community, both here and in Jackson County. And by January of 2021, so January of this year, we peaked at 64 patients in our hospitals. That was the most we had ever seen. And as we tested people in the community, we found that 3% of all the tests that were done were positive. So 3 out of every 100 people who were tested came back positive. And that was the worst that we saw. And thankfully, we had vaccines at that point in time. And unfortunately for us, in our community, the response was not overwhelming. Many people did get their vaccines. I'm very grateful for those who did. But our numbers went down, and by June, as we stopped wearing masks, I, for one, was extremely hopeful that we were done. And in fact, I will have to admit, I sit on the school board. We got emails stating in early July that the kids should go back with masks. And I said, we don't have COVID here. The numbers are almost zero. Vaccinations are here. We are safe. Well, I hate to inform everyone today that that is absolutely not the case anymore. I don't know if it's just the Delta variant or what, but we have seen an exponential increase of, if I say biblical proportions, I'm probably not lying. We have gone from literally 0 COVID patients to now 125 in our hospitals within about 3 weeks. The positivity rate, so the number of people being tested, has risen from literally 0 to 20%. That means 1 in 5 people who are presenting to be tested are coming back positive. This Delta variant is more contagious and more deadly than anything that we have ever experienced in the past. And so all of our thoughts and feelings about what's happened in the past literally need to be put on the shelf, and we need to be prepared for, honestly, an onslaught like we have not seen. It is not inconceivable that we will be like New York City, Seattle, India, or Italy within the next several weeks. The individuals who are getting sick are 93% non-vaccinated individuals. Let me say that one more time. 93% of the individuals in our hospital are not vaccinated, which means that you can still get sick if you have been fully vaccinated, but thankfully those who are fully vaccinated, and if you do get it, are typically protected from being admitted to the hospital. We have individuals who are 30, 40, 50, and 60 years of age who are otherwise healthy, who are in our hospitals and intensive care units with no pre-existing conditions, who are dying. We have 180 patients in our Three Rivers Medical Center. We are licensed for 121. We just got emergency licensing, I think, for 160. We have 43 positive COVID patients, and I just checked our census right now. We have 3 more sitting in the ER waiting for admission. We have hourly people coming to the hospital who cannot breathe. I cannot emphasize enough that this is not a joke anymore. We are in a true healthcare crisis. I am asking and imploring each of you to begin to spread the word to our community that vaccination is no longer an elective thing. We must vaccinate one another to protect ourselves and our community. And we will look like New York City, India, Italy, Seattle here in the next week, 2 or 3. With a 20% positivity rate, that means that our community is spreading this faster than anything we have ever seen, and it takes a week or 2 or 3 for people to become truly ill with this virus. And so our numbers are only going to go up. We are anticipating being over 200 here in a week and possibly as high as 300 patients to require admissions within 2 to 3 weeks. We do not have the capabilities to take care of that many people. Our concerns currently are that we will have to start rationing care, triaging patients. This is something we have never seen before in the United States, and certainly not in our community. So if you have not been appropriately scared, I hope that you are listening to what I'm saying, because this is no longer something that we can just look at from afar. It is up in our face. Now, I would like to close on a happy note, if I may. I want you to know that we have an excellent hospital. We have wonderful staff. We have great physicians and nurses and techs. Everyone here is dedicated to taking care of our community. You have a wonderful CEO in Wynn Howard who is leading the troops. You have great physicians who are dedicating hours and hours to take care of people. You have cleaning personnel who are getting the ventilators cleaned and ready for the next patient as fast as they can. Our community is as safe as it can be with regards to the care that is going to be provided to individuals who become sick. What we need, honestly, is for our community to become vaccinated as fast as possible. We are currently sitting at just over 50% in our community. And at that rate, we are in trouble. So I'm imploring all of the Rotarians, if you wish to do any service today, tomorrow, next week, it is to get vaccinated if you have not been vaccinated, and to start telling everyone that this is a real event and our community will be in crisis. And if we want to save lives, you encourage your friends and family to become vaccinated immediately. So I hope that you have heard what I'm imploring people. I talked to the school boards 2 nights ago. I am talking to as many people as I can to let them know the reality of what we are facing right now in our community, and this is real.